Now, this is an example of a functional rating index. Now, the functional rating index in some circles has been deemed as not a qualified outcome tool. It's the example we have, but it will demonstrate what we're talking about here. So when these different sections, these are functional sections, not so much the pain, but what I can do. In the top level with a 0 is usually I can do whatever I want, but pain doesn't prevent me from walking any distance, or I can't get my fanny out of bed. So you can see that these are scored in this particular way. So with the red numbers, we had 13. And now the second page, you can also see what was included here. And we get all the way up to 22 points on this one. Then I want you to just notice the ones that have 4s in red, because these are generally the things that are the worst and that might mean the most to the patient when you're writing your goals. And you can talk a little bit more about that as we go. So we have 35 points. We have essentially 35 out of 50 leads to this 70% disability, which in this particular thing shows that this is kind of where they are. Now, for evaluation of treatment effectiveness, if they started at 70%, maybe our goal score is 10% or better, or 20% or better, depending on what you know about the patient. So at that reevaluation in 30 days, let's say they come back and they're at 45%. Well, we can do the math and figure out that that is at least 30% improvement, which is what Yeomans has said will justify significant improvement. We, in all courses, would say, we'll continue. This is working, we're going to continue. And as you're approaching the 10% number, maybe they get there, maybe they don't, and you'll make a decision about when that would end if they don't make it all the way there.